Hey everybody, today we're going to be covering Chapter 9, Lifespan Development. So in this book we're going to be going over the various developments that a person goes through across their life, going over neonates and infants, all the way to school-age children, early adulthood, and all the way into a person's late adulthood of life. Throughout a person's life, people experience a variety of not only physical but psychosocial changes and maturity at different rates. However, most of these changes normally occur within a specific period of their life. So a person's lifespan development begins at their conception, from the time that they are conceived, before they're even born. So you have to be able to assess and treat these patients who are in various life stages. You'll need to incorporate your knowledge of what is expected for each stage, not only into the assessment of your patient, but the management of said patient as well. Table 9-1 in your book goes over various vital signs that you will see um, throughout a person's lifespan. This These vitals are divided into infancy, toddler, preschool, school age, adolescence, and the various stages of adulthood. And as you can see, it varies in a variety of different ways. Let me get my laser pointer. For example, a neonate, when at first birth to 1 month old, or excuse me, a month old, their average heart rate when they're awake is anywhere from 100 to 205 beats per minute. And in just a short time as a month span, that top number drops to 180 beats per minute. Now, does a neonate normally sit at about 200 beats per minute? No. When they're born, they're usually sitting at about 160 to 180 beats per minute, and within a few minutes post birth, it usually drops down to about that 130, 140, 150 range. So that's the normal range, but when they're awake, it could get up to 205, and that be normal. By 1 year old, it's at 98 to 140. It's not until they are 12 years old do they get to the heart rate that we normally see with an adult of 60 to 100. Same thing with their breathing rate. A neonate is, when they're first born, they're breathing at 40 to 60 times per minute. 20 to 28 at the preschooler age. And once again, it's not until about 12 to 15 years old do they finally get down to that 12 to 20 breathing rate. Blood pressures are the same way. When they're first born, their normal blood pressure is about 67 to 84 to 35 to 53. Excuse me, 67 to 84 over 35 to 53 for their blood pressure. Even when they're 12 and they're adolescent age, it's still not at that normal blood pressure that we generally say for an adult, for as far as a range, until their cardiovascular system is fully developed and their body's fully developed. Do you get that 120 over 80 or less as a normal blood pressure? Because everywhere in here there's a multitude of different changes occurring within your patient. Every child develops at his or her own pace. However, if an infant is not able to perform expected tasks within the normal time frame, the infant should be evaluated by a physician. So you, as an EMT, should know which type of movements and activities are expected during each of these periods so they can better assess the pediatric patient and understand his responses. So at the neonatal level, they're not going to be able to do a whole lot of movement. Obviously, they're not going to be able to walk. All they're going to most be doing is, kicking and flailing. But they should be able to do extension and flexion, maybe a little adduction, abduction. Um, they're going to be unable to lift their head because their neck hasn't fully developed yet as far as the musculature, and their head is actually heavier in proportion to their body. At this young age, they also have what's called the Babinski reflex. What the Babinski reflex is when you stroke the bottom of their foot, their toes span out. When you drop, another reflex that they do is where they would somewhat drop the infant. Now, obviously, they're not dropping them from a severe height that will harm the infant. But what should happen is the infant spread its arms and try to catch itself. These are all normal reflexes for a neonate. As they continue to age, these reflexes go away. At 12 months, this is usually about the time that they should be able to start crawling. The Babinski reflex is usually gone by this point. They should be able to identify, maybe not necessarily know what something is, but at least when someone new walks into the room, be able to see them. They can start identifying their parents, maybe even potentially starting to walk at this point. A neonate's heart rate ranges from 100 to 205 beats per minute. At birth, this heart rate is normally 140 to 160, and then within the first 30 minutes it decreases to about 100 to 160, then usually settles to around 120 beats per minute, and remains that way or maybe decrease a little bit throughout their infancy. However, their heart rate can range from anywhere from 100 to 180 beats per minute. So in general, as an infant ages, their heart rate and respiratory rate will decrease as their systolic blood pressure increases. By year one, their respiratory rate is now at about 20 to 30. Uh, their Give me one moment, ladies and gentlemen. Sorry about that. I had someone called me and I didn't even realize it. Um, anyways, so their tidal volume is beginning to increase as their lungs are continuing to develop. Their blood pressure is still on that rising trend, and their temperature is still a little bit above normal because they have a higher metabolic rate. The initial birth weight of a neonate normally drops between 5 to 10% within the first 2 weeks of life. That is normal. So if you're a first-time parent and you're like, "Oh my God, my baby just lost, 5% of their weight or 10 or dropped 10 pounds or not 10 pounds, but a pound or two," don't wig out. This is normally regained shortly thereafter. The baby's weight they'll continue to increase throughout their infancy with proper nutrition. Infants require either breast milk or formula, whichever one you as the parent would decide you want for your child and what they can handle, to meet their nutritional needs. As they progress through the first year of life, those begin to able to consume other soft foods without yet having teeth. This is when they're eating that puree diet where it's all mush. Some other changes that they go through, they are primarily nose breathers up until their fourth week of age. So this is why it is very imperative that you ensure that their nose is clear because of how their tongue proportionally larger than their mouth, and their being a primary nose breather, their airway becomes easily obstructed. Um, their lung tissue is very fragile, so if they get a respiratory infection, it could be very drastic for them. Um, and with infants, most pediatric patients, when they have a respiratory issue, they're able to compensate for it very well. But when they are unable to compensate for it anymore because their accessory muscles are so weak and their lung tissue is so fragile at this point, they decompensate very quickly. So they can go from stable, 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 crash. So you've got to stay aggressive when dealing with a pediatric patient. Infants have immature accessory muscles. This makes them easily susceptible to early fatigue from labored breathing. Their less rigid chest wall and more horizontally placed ribs also promote diaphragmatic breathing. Therefore, you as the EMT should examine both the chest and the abdomen when assessing an infant's respiration. Most of a neonate's immunity is based on antibodies that he received through the placenta from his or her mother during pregnancy. This is called passive immunity and is normally retained through the first 6 months of life. Babies who are breastfed may also receive antibodies from their mother's breast milk and will retain this immunity as long as breastfeeding continues. Reflexes can include blinking, startling, rooting, sucking, swallowing, gagging, and grasping reflexes. Their strong and coordinated sucking and gag reflex help them survive because they're able to, because of their immune system being so immature, they're able to throw up a lot if they're just getting too much stuff or if they become very irritated. Infants are also able to sense pain and touch, although they aren't developed enough to be able to localize the pain. It's important to consider that an infant may experiencing pain if the infant is crying. They also have what's called fontanelles or soft spots within their skull. Never press on these fontanelles. Normally these fontanelles are level to the skull. If the child is dehydrated, these fontanelles may appear depressed or sunken in relation to the rest of the skull, or full or raised if the infant has some type of infectious process going on or an injury causing an increase in intracranial pressure. If an infant is not able to perform any of these tasks within the normal time frame, so up to 2 months, they should be evaluated by a physician to determine if there's any kind of neurological damage or birth defect that they may have been born with. By 2 months, they should be able to focus on objects up to 12 inches away, be able to track things going around, being able to recognize familiar faces such as mom or dad. By 6 months, an infant should also be able to push down on their legs and feet when held over a firm surface. Begin to start making babble sounds such as mama, da, dee, and try to begin imitating familiar sounds. They'll start developing gross motor skills and be able to grasp certain toys and begin to shake them. They'll also start being able to recognize familiar objects at a distance, such as mom walking in from a faraway door. The infant may be able to start noticing them. By 12 months, the infant should also be able to imitate some words and gestures and facial expressions that they see from their mom and dad and from other people. They should also begin to start using objects that use maybe a little bit more finite skills, such as brushes and cups, and correctly begin to be able to finger feed themselves. They'll begin poking objects with fingers. They'll start saying the parent's most favorite word, no, and be able to respond to simple requests. You may also encounter different responses when you attempt to take an infant away from their parent. In most cases, the infant will protest and act as if in despair and withdrawal when separated from their caregiver. To them, you are not their caregiver and they will tend to be afraid of you. Try to keep the parents calm. Although the infant may not be able to understand what's occurring, they can identify changes in emotion and gestures, especially from their parents. If the parent is upset and scared, the infant will usually respond in the same manner. So try to keep mom and calm. Say, hey, you're not helping your baby. Stay calm, so that way your child will stay calm, and I can help them. As they continue to progress, you start getting into um, the toddler phase. A toddler is those between the age of 1 to 3, and preschoolers are those between the ages of 3 and 6. Um, as they develop into that toddler range, their heart rates are starting to continue on that decreasing rate. The respiratory rate's beginning to still coming down. Blood pressure still coming up. Their temperature, it's still a little on the hypertensive side for what you would think of the normal being 98.6. But for them, if they have a 99.4 degree temperature, that would be normal because they still have that increased metabolic rate. As they progress into preschoolers, their blood heart rate is still continuing to come down. Respiratory rate still also. Their blood pressure is starting to come up a little bit more. Some changes that they're starting to go through. They're beginning to lose their baby fat, so they're beginning to increase their body mass. Um, their baby's primary teeth are beginning to come out, and that passive immunity that they had as an infant is, if not already, um, beginning to get lost. But as the passive immunity is being lost, they're beginning to develop active immunity. So now they're actually, as they're exposed to certain pathogens, their body's able to fight it, identify it, and start building its own immune system. At this point, toilet training should be going along also. Is normally completed around 28 months, but most children will continue to experience some bedwetting at night up until they're 6 or 7 years old. Excuse me. By the time they hit 3 years old, they should be able to start recognizing names and faces, objects, and body parts. If you hide something, they should be able to find it. They'll start climbing up and down furniture, carrying several toys when walking. So when you have the toy chest, put away, all the toys put away, next thing you know, you turn around and everything is strewn all over the place. So these are what you'll start seeing at 3 years old. They'll start walking alone. They'll start running. And you're having to run after them. By 5 years old, they should start being able to stand on balance on one foot. They're starting to develop the more finite skills. They should be able to start using forks and spoons and knives as appropriate. I would still recommend with adult supervision. They'll start being able to hop and swing and do somersaults. Start being able to get dressed and undressed without assistance. Probably still need to have their clothes pulled out by mom or dad, but at least be able to go ahead and get dressed without them. By 18 to 24 months, a child can also begin to understand cause and effect. Most children develop separation anxiety at approximately 18 months of age. This reaction normally includes the child clinging to the parent or caregiver and crying when that person leaves. By age 5, a preschooler can usually say their name and address, and they can also recall and tell stories using sentences. When speaking to a child, you want to speak to their level. So you don't want to use big words such as hypothermia or hypoglycemia because they're not going to understand it. So get down to their level, break it down, and instead of standing and towering over them, take a knee, get down to their face. They're going to be worried, scared, even if for about checking, listening to with your stethoscope. Let them touch the equipment. Let them get their hands on it. Let them build that trust with you. School-age children, those are those between the ages of 6 and 12. They're starting to enter into elementary and middle school. At this point, friendships are very important to these children. So it's imperative that definitely during your toddler years that you start building their social skills. Let them hang out with friends, go to the park, get them involved in after-school activities. Um, at this point, their heart rate's continuing to on that progression down. I know it's out about 75 to 118. Respiratory rate is 18 to 25, and their temperature is beginning to normalize. It's at that 98.6 rate. Also, the bones in their musculoskeletal system is continuing to increase in density and continue to grow larger. Most children will begin experiencing some type of discomfort when this occurs as they go through growth spurts. This group will also lose their primary teeth and replace them with their more permanent teeth. As their brain continues to develop, their brain function continues to increase in both hemispheres. Also, children in this age group are normally able to are able to read and write. Nocturnal enuresis or wetting the bed at night may still continue after the age of 10. School-age children also develop their own self-concept. That is, a personal concept of who they are. These children compare themselves with others to help determine their own values and to seek the approval of others. School-age children also understand how to obey rules and avoid punishment. They also understand concepts associated with pain and illness and death, but most are still uneasy or scared when these situations occur. Most school-age children can identify EMTs and firefighters and law enforcement officers as people who can help them in a crisis. However, they may have unrealistic expectations about what you are able to do, so explain to them what it is that you're doing and why you are doing it. Adolescents are those between the age of 12 to 15. Some sources say 12 to 18. Most adolescents within this in this age range, still want to be treated as adults. However, they're not. They're still continuing to experience various physiological and psychosocial changes throughout this period as they're continuing to progress through their life. Their heart rate and respiratory rate is starting to come down and is in that normal range. Their blood pressure's coming up. For most of those over the age of 16, usually their vital signs are the same as that as an adult. During adolescence, they're having various endocrine changes occur and specific hormones are released in their bloodstream. With men, they're beginning to grow facial and pubic and axillary hair. They also begin developing a deeper voice. Their shoulders start to broaden and their muscles become larger as they continue to develop. Also, the adolescent male's penis and testes also increase in size, and the adolescent has erections that result in the ejaculation of semen. Females begin going through menstruation, and their breasts begin to enlarge. They also start beginning to grow pubic and axillary hair. Their hips normally widen and the waist gets smaller as the various hormones are beginning to be released into their body. They also have many biological, social, and emotional changes that occur during adolescence can cause family conflicts. Most of these conflicts revolve around the adolescent and their parents. Adolescents become more argumentative and more aware of the shortcomings of others. They want to have a sense of privacy, and most don't want their parents present during the patient interview. So if possible, let them have that sense. Interview them in private, but still somewhat have the parents involved. During adolescence, both boys and girls experience an increased interest in the opposite sex and begin dating and or participating in sexual activity. Because their bodies and sex cells have matured, they are capable of reproduction, even at as young as the age of 11 or 12. Some adolescents, based off personal beliefs, choose to abstain from sexual activity during this period. Participation in unprotected sexual activity during this age range increases the risk of acquiring sexually transmitted disease and the risk of pregnancy. Though they're beginning to understand there's consequences for the things they do, and they're concerned with their body image. So, like you do with adults, let them have privacy. If they feel that they're another thing, and its body image is another thing that causes issues within the family. If they don't think they're pretty enough, or they don't have the right clothing, because Sally Sue got $100 pair or $100 pair of high heels, and your parents were only able to get the $30 pair. They're not happy for that because it wasn't their money. Early adulthood, those are those between the ages of 20 to 40. At this point, their heart rate is, for the most part, normalized at a resting rate of about 70. Blood pressure sitting about 120 over 80. Their respiratory rate is at that 12 to 20 range also. Because of the young adult's excellent physical condition, at this point their body is at its optimum peak. This is the best that they're ever going to be at. And at this point, once they reach that optimum, their body begins to go downhill. So, because of their excellent physical condition, they're more capable of risky activity. Hence, accidents are the leading cause of death within this age group. However, once they reach their peak, their physical condition begins to slow down. They begin to gain weight, store fat, and experience decreased muscle tone. Their spinal discs are also beginning to settle. During this period, adults also begin developing lifelong habits and routines that will impact the quality of their health and life for the remainder of their lifespan. Upon entering early adulthood, people generally also take on more responsibility and become more independent. Many young adults choose to leave their parents' homes and make homes of their own. During this period, most also begin developing romantic and affectionate relationships. They begin to get married and begin their families of their own. Hence, childbirth is most common within this age group. Their new families start providing new challenges and stress for the early adult. It's also during this time that many adults are beginning to finish school and start finding careers to support their family. About the time that they reach age 40 to 41, they start entering what's called middle adulthood. This is range 41 to 60, and there's really no significant changes in the normal vital sign levels between early to middle adulthood. During middle adulthood, the body is still functioning at a pretty high level, but can you start noticing some varying degrees of degradation. Body systems begin to also experience some more changes because of disease and lifestyle decisions. Adults in this stage are also more susceptible to chronic illnesses and diseases like diabetes and arthritis. It's usually during middle adulthood when cardiovascular health also begins to become a concern. Cardiac output is beginning to decrease throughout this period, and cholesterol levels are increasing. This hence makes people more susceptible to cardiovascular diseases. Cancer is also a concern and strikes this age group quite frequently. So it is imperative that they begin to get screenings for various types of cancers as they are going into this group. Middle adulthood is also the period when many individuals are reaching their goals and trying to find ways to help younger generations. Some adults experience a period of self-questioning if they haven't been able to accomplish their goals. These adults have experienced many different problems within previous stages of life and have developed coping strategies that can be useful throughout the remainder of adulthood. This age group is also aware of the limits of time, and many formulate new goals for the remainder of their life. So they're starting to look forward to retirement and preparing for it. As you get into late adulthood, this is age 61 and older. This is up to the maximum lifespan, which is theoretically longest period of time for an organism to live, which is 120 years for a human being. An individual's life expectancy, however, is the average years of life remaining based on their year of birth. And it varies on your how you spent your life, your decisions, habits, what you put into your body, your well-being. So your vital signs also vary based off of that. Almost all individuals will die as a result from diseases or accidents before reaching the maximum lifespan. The incidence of diseases and illnesses continue to increase with age. During late adulthood, most body systems also continue to become less efficient. As they continue to age, their brain begins to become smaller as they begin to lose neurons within the brain. This is when they start developing dementia. Um, their reaction times begin to slow, so they may not be able to react to stuff as quick as they used to. As they may also start noticing changes in the respiratory system because they start developing COPD or emphysema, congestive heart failure, and it's affecting their lungs. Because of the nature of EMS, many adult older patients that you are called to treat will experiencing not only the current emergency, but one or more chronic illnesses as well. However, there's a wider variation of health status in this group than in any other. Although some people at this time of life have serious mental or physical problems, many others maintain good mental and physical health. They lead very active lives throughout their late years. When dealing with an older adult, be aware of the possibility of an underlying ill health, but do not assume that every older patient has a chronic physical or mental deficit. Also, because older adults have been independent and self-reliant for most of their lives, some may feel ashamed or otherwise reluctant to give up their independence and ask for assistance. Combined with many of the physical changes and illnesses that they may have, this can lead to a decline in the older adult's well-being and sense of self-worth. Many find themselves incapable of performing activities that they once performed easily. Many of these adults experience the death or dying of their spouses or companions. This may leave them having a feeling of being more alone and isolated than ever before. It may also begin to cause them to think more about their own death. While there are many psychosocial challenges associated with aging, most older adults are able to remain in their own homes and lead very rewarding lives. Most don't need to go to a nursing home or to an assisted living facility or even have to live with relatives until an advanced age, if at all, if they're able to still manage their own selves. Alright guys, that's it for today. If y'all have any questions, be sure to either email me in Blackboard or let me know next time we come in class. So if you have any questions and you've got one to ask me in class, just make sure you write it down. Um, Make sure you're reviewing all of your slides because you'll have your comprehensive exam coming up very soon. See y'all in class.